But now, actually, we have a specific therapy for this disease. If a person who gets HIV infection who gets proper treatment and monitoring, actually this person can have a normal life, just like a person someone who's not having HIV. For example, if a person has diabetes, if this person has good control, this person can have a normal life. And so same as this HIV patient. So if they have a proper treatment, they get a proper treatment, proper monitoring, they can have a normal lifespan as well. So it's important for the screening. Okay, the answer is no for these three questions. Okay, first, mosquito bite is not the way of transmission. The transmission is actually through body fluids, for example, blood, semen, and the vaginal fluid, and also breast milk. So the mosquito bite, they actually bring a very, very little of the blood, which it can be ignored. So the rate is actually considered low. And the hospital syringes, actually we're using disposable syringes so that every time we use the syringe, we would discard it away. So we won't reuse the needle and syringes over and over again. So it's considered very safe when you receive treatment in hospital. And blood donation, actually every blood donor will screen for HIV infection first before they can proceed to blood donation. And so the risk for getting the HIV infection through the blood donation, blood transfuse is maybe less than 1%. Okay, the main transmission way in pediatric patients is mainly the vertical transmission, we call from the mother straight away to the child through the placenta. Okay, actually there is where to prevent the transmission. The pregnant, usually in Malaysia, every pregnant woman will be screened for HIV infection. So when we detect those mothers who got HIV infection, they need to have a proper follow-up and receive treatment to reduce the viral load and thus reduce the rate of transmission to the child. And during birth, we will suggest the mother choose cesarean section, which also reduce the rate of transmission. And of course, during delivery, we give antiviral therapy also to reduce the rate of transmission. And also after delivery, we advise not to breastfeeding the child because breast milk actually can transmit the HIV virus also. HIV infection has 3 stages. First is actually the acute illnesses, maybe you just have some flu-like symptom, headache, fever, and all. It's actually not specific. Most important thing is if you suspect you got contact with an HIV patient through the blood or sexual intercourse, the most important is to screening because the symptom is not really specific. And after the acute illnesses, you have a long latency phase, means that no symptom at all. You're like a normal person, so it's actually no way to detect through the symptom unless you proceed to the third stage, the late stage. Okay, for HIV infection, we have this antiretroviral therapy, ART. There are actually more and more therapy coming out. We have the PIC regime, many regimes are available. So if a person who are diagnosed with HIV infection, the most important is you need to meet your nearest healthcare provider, the doctor so that they can refer to the infections control specialist. They will have a specific treatment regime for this patient.